and we're excited to hear a little bit more about how she is transforming patients' lives with anti-aging science. So Dr. Sparks, are you there? You're there.
Yep.
There you are. Okay. Everyone disappears off my screen until they speak again. So thank you.
Thanks so much for having me, you guys. And yeah, anti-aging is super important to me. And I think longevity medicine and lifestyle medicine in general is very, very important. And like Lisa's little cartoon showed, Dr. Copes knows that like people want to get the pill or the quick fix, but they're not willing to kind of take accountability. And I really wanted to bring that back. It's like, how can patients have accountability and look at the things that they need to do to really take an active role in overall health and wellness? So I've actually spoken about longevity medicine all over the country, and I've done some international stuff related to spinal cord stimulation and pain management. I'm an anesthesiologist who trained at the Cleveland Clinic, and I did my pain fellowship there a long time ago already. And medicine is a problem, right? Like we miss, as chronic pain doctors, we missed kind of the heyday of the free-for-all for pain doctors, right? Because that was when things were kind of new and novel and they weren't putting so many restrictions on it. By the time myself and Dr. Kropp and some of our other colleagues have gotten out, that kind of had gone and washed away. So what that meant is that everything had to have a prior authorization. Everything had to be approved by insurance. And there was just more and more layers and layers of paperwork. And if you guys aren't familiar with corporate medicine and the way it is, if you have a prior authorization, that does not guarantee payment to the doctor. So what happens a lot of times is we could do a procedure, you could get better from it, you can go home, you're still paying your insurance premium to the insurance company. However, we might not get paid for the procedure that we've already used our supplies, our time, and our staff, and our things and our skills to do. So I kind of have said this many times, that insurance company's job is deny till they die, and they will do that to doctors more than anything. So that's the problem with being in corporate medicine, is you see that, and it's a sick care system, and that sick care system is unfortunate because it wants to keep people sick and keep them small and in the system. However, if we look at these things like Ageloc Youth, which is a great product that has resveratrol and a lot of other elements that help with longevity and helping to increase the length of the telomeres. And if you're looking at genetics, the longer your telomere length is, the more proclivity you have to being more youthful, even despite your chronological age. So that's all very important material. So aging is inevitable, but the ability to increase the length of the telomeres can keep you younger for longer. And by younger, it doesn't necessarily mean that you're not getting older, that you're not getting wrinkles, because those things could certainly happen. But if you're taking plenty of collagen and you're exercising and you're doing things that help to change your epigenetics, then in fact, you are going to have a better functionality, no matter what your chronological age is. And that's really what I try to stress to patients, is like, if we can have you to have a better quality of life, it is worth every nutraceutical or exercise regimen or pill or shake that you take, because you're going to feel better and you're going to increase that genome to replicate in a way that doesn't necessarily make you become decrepit as you age, which is what we see a lot in the sick care system that we're currently involved in with corporate medicine. So this is why we want to take these age-related genes and make it more of a youthful state. And that's exactly what Ageloc Youth actually aims to do, is to help to program those genes that would generally program in a way that would become older and have like more mutations and more circuitry miswiring, and help it to stay at a more youthful production, because you're constantly replicating those things. Like, you shed your skin, so those genes are replicating all the time to make new skin cells. But if you're making a more youthful skin, you're going to look better and present yourself better. And that's the kind of the aesthetic part of anti-aging. But we're also looking at those two pictures, if you can put that back up, Christy.
Okay.
Those identical women, identical genes, but you can see that one looks like a decade older. Now, it looks to me, just by a quick glance at that picture, that one lady might have some more skin spots, maybe she can wear as much SPF. There's a lot of factors that could be playing into play, but it could have a lot to do with the food they ate, the exercises they did, the nutraceuticals they took, and then their diet in general. So we really want to concentrate on what it is about epigenetics that we can do, that we can modulate, and that we can use these nutraceuticals and these other things to kind of have a better chance of having functionality for longer, and presenting in a way that maybe doesn't have as much arthritis, or maybe doesn't have as much cardiac disease, or things of that nature that we hear all the time related to aging. So this guy has been kind of in the news multiple times, heavily spending so much money every single year, $2 million per year, because he does not want to be older. Now, the way he does it, they're looking at specific biomarkers, and some of those biomarkers we are already starting to look at here within PharmNex, and looking with how those will replicate. And that's why when we do the scanner and we're looking at the antioxidant score, that is definitely, the skin keratinoid score is sure to tell us more and more how we're having more antioxidants. And again, just to review again, more antioxidants you produce, the less free radicals you produce. So if you're making less free radicals, then you're not going to have as much proclivity to disease. So the higher your free radicals, because of the lower your antioxidants are in a state of unwellness or illness, then you're going to produce more cardiac disease, more diabetes, and more other things, because free radicals can also lead to causing mutations among the genes, which can lead to cancer and things of that nature. So this again is just another little slide that shows the older genes and the gene expression profile versus the younger genes. And the more you're taking Ageloc Youth twice a day on a regular basis, you are going to change to that gene expression of red in the old age to being more green. And we want to see that flip, because that flip is going to allow us to produce those genes and increase the length of those telomeres, and use epigenetics really to the full benefit. And there's plenty of studies out there related to the resveratrol, which is one of the main ingredients in Ageloc Youth, which does promote all of these kind of increased functionality and increased length of the telomeres for the gene expression. Now, if you look at the one that has the more green at the top, that's the desired gene expression. And then looking at the one at the right is the positive modulation for the gene expression. And that's with taking the Ageloc Youth to allow there to be more positivity and more green, as opposed to the red that you've seen on the previous slides for aging. So Ageloc Youth promises forever, right? That you're going to modulate the aging defenses, and that's going to have preservation. It is proprietary. So like I said, there is resveratrol in it, but there's a lot of other things in there. That's the proprietary blend that PharmNex is. And this is very, very difficult to get in diet alone. Like I think Dr. Krupp said, well, you could eat all those purple things, but you're not going to probably eat them in the same manner and in the same combination and things that you can to allow the more active, energetic, and healthy lifestyle that you can get from taking these nutraceuticals on a regular basis. So there's other different ingredients like cordyceps. That's like definitely one of my favorite. You can get that from PharmNex just all by itself, or you can get it mixed in with other things as well. And that allows for some energy. And especially a lot of our patients are on opiates. And if you see a high opiate concentration that a guy's been on for a long time, and he's taking a lot of medication just from all of his other wellness, he tends to have more energy and he tends to feel better just with those cordyceps. And the Panax ginseng, again, another energy provoker, but also good for allowing people to just have a better gene regulation. Of course, pomegranate fruit extract is known to be great for just overall longevity. and then red orange grape seed extract and broccoli seed extract. All of these are good for the overall increase of antioxidants. So this formulation we know improves physical endurance as well. So if you look at the control over week 0 and week 5 versus with Ageloc blend, 63% increase in physical endurance. And that's a really strong clinical significance where you're seeing the patients are getting physically stronger and they are able to do more, they're exercising more, they're maintaining their energy better, and all at the same time, they're feeling better about the way that they're doing their things on a day-to-day basis, whether their daily lifestyle is sedentary or not. 63% is impressive to have that kind of increase. So when patients take Ageloc Youth twice a day, as prescribed, and they feel better, not only are they having these improvements, but they're also, like I said, with the epigenetic side, increasing the length of their telomere and able to have actual gene changes that are done. And the improved cognitive function, we hear a lot about dementia, whether it's vascular dementia, Alzheimer's, or any other sort of dementias that are out there. People are able to take this medication, and a lot of people have talked about ginkgo biloba and all these other things out there. But the problem is that other companies are not controlled and do not look at their quality assurance and what products are what's going into those products, where we know at Pharmanex they do. I've been to the labs, I've met with Joe Chang, and I've seen some of the top leaders in the medical advisory board, and they're all making sure that the quality of the stuff that goes into these nutraceuticals is spot on and right. They will not put out bad product, where you can't guarantee that if you go to some other off-label or GNC or Walmart version. So, and this is just showing that versus the placebo versus being on Vitality, which again, full of cordyceps, and Ageloc Vitality or Ageloc Youth, both are very good for improving cognitive function, whether that's short-term memory, executive function, working memory, information processing, and then just pattern recognition. All of these things are very important when you're doing geriatric testing as well. And if you look at the brain health study in the fMRI, they show improvement with both attention, memory, and error detection. Again, this is all things that are important if you're still driving, if you're balancing your checkbook, if you're going and using your credit card, or just using working memory in general. So as people get older, these things tend to slow down, but if it's improved with taking these medications, and as shown on the fMRI studies where you can see the yellow has lit up, those are all the areas of the brain that's important for these activities. And again, just like I was saying before, they do test these things as people get older, and this will increase the verbal fluency, their mood, and their overall memory, and their scores on cognitive tests as well. So the aging defense mechanisms, if you look at without Ageloc Youth and then 2 months with Ageloc Youth, you can see overall that their skin defenses too are better as far as versus UV exposure. And I think that that's a very significant thing too, because when you're using Ageloc Youth, and if you use it in combination with some of the other products out there that are out there with new skin, it's the devices for the skin or the lotions and whatnot, you can see an overall improvement in skin texture and overall color. And this was presented, as you can see, at the California World Congress, looking at the brain cortex. And if you look at the group with the Ageloc Youth and the anti-aging intervention group, that those show much more improvement considering the old group and the brain cortex. So we definitely do want to allow there to be more synapses for longer, allow the brain to function at a higher level, because we do know neuroplasticity is very important. And when you age, if you continue to work on that neuroplasticity and then take these supplements in conjunction with it, you're going to improve all of these areas cognitively.